Good evening, everyone. Welcome to Valley Eye Associates' first webinar, Know the Facts About LASIK. My name is Tricia. I'm joined here by Dr. Michael Vrabec, and tonight we are going to be discussing LASIK and answering all your questions. So first of all, Dr. Vrabec, thank you so much for joining us tonight.
Well, thanks. What a great idea, Tricia. Thanks for doing this.
Absolutely. Would you like to take just a couple seconds to introduce yourself to our viewers?
Well, I'm Michael Vrabec at Valley Eye Associates. I've been here for over 20 years. We have an active LASIK practice as well as cataracts, a full scope of ophthalmology with medical retina, glaucoma, eye exams, things like that. So Valley Eye is well known here in the Valley in Northeast Wisconsin, and it's just real fun to be here tonight.
Yes, thank you very much. And we're very lucky not only to have him here in the Valley, but also to be answering your questions tonight. Dr. Vrabec was actually the first surgeon in the state of Wisconsin to perform all laser LASIK. So again, thank you very much for taking the time to be here.
You bet.
Just a couple housekeeping things for you guys tonight. So like I said, we're going to be discussing LASIK. Please feel free to type your questions in the comments section along the side there. And I'll be looking at your questions live here on my phone, and then so type them up and then we'll verbally answer them. For viewing the webinar tonight, we do want to extend a discount to you guys. So we're going to extend a $200 discount to all the viewers. So all you got to do is mention this webinar when you schedule your free VIP LASIK consultation, and that's how you will receive the discount. So to schedule your free consultation, all you got to do is give us a call at 800-344-4443, or you can go to our website, valleyeye.com. And again, just mention this webinar, and you will receive $100 off each eye for LASIK. We do ask that you schedule that free consultation within 30 days of this webinar. So, and we can talk more about that later, but Dr. Vrabec, do you want to start out by giving us a general description about LASIK? What is it?
So LASIK is an all-laser procedure designed to reduce or eliminate someone's needs for glasses. The typical candidate or good candidate for LASIK would be someone who's nearsighted, who's over the age of 18, whose eyes are stable, who has trouble or doesn't want to wear contact lenses, and finds that wearing glasses can be a problem, either because they fall off their face, they fog up, the vision isn't quite as good. So that's the sweet spot for LASIK. So say 18 years old to probably early 50s, something like that. And like I say, what we're trying to do with LASIK is reduce or eliminate someone's need for glasses. And that can be because they're nearsighted, farsighted, especially astigmatism. A lot of people think that LASIK can't fix astigmatism. That's just not true. LASIK does a really nice job with astigmatism. And it's far and away our number one laser vision correction procedure and the most commonly chosen way to reduce or eliminate your need for glasses.
Excellent. That was a great description. Thank you very much. That was perfect. And we'll get into the questions now because they are already rolling in. One question we have here is LASIK painful?
LASIK is not painful. There's two parts to the LASIK procedure. The first part is making the flap. That's a protective flap on the cornea. It's about the thickness of a soft contact lens, and we use a laser called the femtosecond laser to make that flap. So while we're making the flap, believe it or not, that flap has little pulses, tiny little soft pulses that create a flap. It fires 12,000 times a second, so it's ultra fast, even faster than you can talk. Sorry.
Yes.
Anyway, the point is, while that laser is treating the eye, we want the eye still. Okay. So we apply a little suction ring to hold the eye still. So people will feel a little bit of pressure. They never feel the laser. They don't see the laser. And so that's the first part of LASIK. The second part, when we lift up the flap and reshape the cornea based on what you need to have done, that they don't feel at all. When they go home, the eye's a little sore, irritated, like they got something under the contact lens. That lasts about a day or so, and that's about it. So anything worse than that is unusual, and we should get a call about that.
Okay. Excellent. We have another question about the results. Do folks notice an improvement in their vision immediately? Does it generally take a couple days for them to reach that 20/20 sweet spot? or do they notice immediate results?
Right. So it's really fun. I shouldn't tell people this who are going to have it done, but when you have LASIK, we lay you flat on a laser table, and of course that's where we do your laser, and we have a vision chart up on the wall or on the ceiling. So patients are laying back, and when they first have it done, typically their eyes are so bad they can't see the vision chart. We'll do the flap, we'll do the reshaping, and sometimes we call it the flap and the zap. It's a little trade name there, but making the flap, reshaping the eye, putting the flap back down, and then when we swing them back and they look for the first time at the ceiling and they can see, we make you see clearly, you can just tell a big smile on their face. So it's better right off the bat. Now, it's not perfect, and we tell patients it will get better, but it's amazing how quickly LASIK can work.
Excellent. I have seen that chart on the ceiling. I have seen patients get emotional in just the most wonderful way, and it's like that. This is why we do what we do.
Right.
It's wonderful to see those reactions. That's what it's all about. We have another question about LASIK. Can LASIK be done for folks? Let's say they're in reading glasses, and the concern is not their distance vision. Their concern is actually their near vision. Is LASIK an option for them?
LASIK is an option for them. Now, depending on what their prescription is, whether they're nearsighted or versus whether they're farsighted, and just how far over the age of 40 they are, LASIK could be our number one choice, or frankly, it might be number 2 or number 3. So it really depends on the patient, what they need, what their prescription is, and other factors too. Do they have dry eyes? Do they have the start of cataracts? Those types of things weigh into our discussion. And that's one of the nice things about Valley Eye is that we offer several different forms of vision correction, and we usually can pick the one that's right for you or the patient coming in.
Excellent. That sounds good. We have a question about LASIK. How is LASIK billed? And questions about insurance. And does insurance offer any discounts? Does it cover it completely? Any comments on billing for LASIK?
Well, generally speaking, LASIK is considered elective. And I like the word elective. I don't like the word cosmetic. A lot of people will say, well, LASIK is cosmetic. And sometimes I'll tease patients that I've known for years. I'll say, you might look better in glasses than you do without. And so cosmetic is a word that I don't like in terms of LASIK because it really does improve someone's function. You look at the Army. If you're enlisted in the Army or the Air Force, the Armed Services will actually pay for your LASIK because they know, and people have known this since the turn of the century, that soldiers that have to wear glasses or contact lenses won't work as well, they won't fight as well as those that are glasses or spectacle free. That concept goes back to the turn of the century, and I'm not talking about the year 2000, I'm talking about 1900. So back in 1900, the Japanese were doing a surgery called RK, and they were doing it on all their soldiers, thousands and thousands of them, to get ready for war. So it's functional, it's not cosmetic, but it is elective. In other words, it's not a life or death situation. It's not a situation where if someone doesn't have LASIK, they're going to go blind or anything like that. So it's elective. Most of the time when something's elective, insurance companies say, well, that's nice if you want to have it done. Since it's not medically necessary, we're not going to pay for it. Mm-hmm. And that creates a market situation. And a lot of people in government and in society want more of that. They want competition. They want people to say, well, if Valley Eye isn't good, we'll go down the street and we'll see what they offer. And so patients compare, the results, the equipment, the doctor's experience. And sometimes they put in price as well. And they say, okay, we'll put all this stuff together. And if Valley Eye got 10 times more expensive than the guy down the street, well, people probably wouldn't come to us. So all these market forces work to keep LASIK at quite a reasonable value. If you look at the return on investment, so to speak, of having LASIK compared to the cost of glasses every year, contact lenses, and the fact that you use your eyes 24/7, 365, it's really quite a value. So all that being said, most of the time LASIK is not covered by insurance. There are some insurances, however, that do offer discounts. So that I don't know all of them offhand. You probably know better than I do about that. But if someone is part of a certain insurance group, they may well qualify for a discount. And that's something that they can check into.
Definitely. Yep, when you come in for a free consultation, and first of all, we'll make sure that LASIK is a safe and effective option for you, that you're a good candidate for the procedure, but we absolutely can check and see if your insurance company does offer a discount. So absolutely, we could check on that. We did want to actually launch a poll question, and so a little bit of interaction here during the webinar. So you're going to see a question come up on your screen, and we just kind of want to get a feel for the audience that we have. So go ahead and answer your question in the poll there, and then in a few minutes we'll return and see the results. So, but in the meantime, we'll continue with questions here. And we have a question coming in about kind of going back to LASIK, who's a good candidate for LASIK. Is there an age limit, a minimum age that you have to be at least, or a maximum age that maybe you're too old for LASIK? Is there an ideal range? I know you mentioned that before. But,
right, yeah. So again, for instance, kids in junior high, high school, their eyes are changing, and it's generally good to make sure kids are usually out of high school for sure, if not college, because many times when kids are in college, even their eyes will be changing. Now, that being said, we do want to make sure that someone's eyes are stable for a year. So if someone comes in and they're 19 years old and their prescription hasn't changed for a couple of years, and especially, I used to think that all college students were as studious as I was and as careful as I was with contact lenses and things like that. And frankly, that's not the case. Some people, it's just amazing how they abuse their eyes with contact lenses. So sometimes I will get a little nervous on how, like my daughter, when she was in college, I got her the contacts she threw away after every day, because when she was telling me some of the stories, and I'm an eye doctor, what's going on here? So the point is that our eyes have to be stable, that the prescription can't be changing a lot. Again, technically age 18 or above. And then once you get, beyond 50 or so, sometimes a little bit of cataract can sneak in, or there could be other things that occur that, again, put us away from LASIK. So certainly the 20 to 45-year-olds, that's probably our highest percentage, are people in their 30s, late 20s, 30s.
Okay. Excellent. Now, one thing to consider as we move through the LASIK pre-op process, we have a question coming in about dry eyes. If someone's eyes are already a little dry, how do we want to make sure that does LASIK make that worse? Can that disqualify them from having LASIK? What about dry eye?
Well, great question. So there's a whole range of dry eyes. Some people might have a little bit of dryness in the winter months when we're driving in the car and the defroster is going and the air is very dry, or like I said, in the winter at home where you have space heaters on, things like that. And then the rest of the year they're fine. Or some people might go out to Arizona where the climate is really dry for a week and say, oh, my eyes are kind of feeling dry, but get back to Wisconsin and they're fine. Others, on the other hand, can have debilitating dry eye condition, especially those with a condition called Sjogren's syndrome. That is arthritis, usually a dry mouth and dry eye. And those patients can have serious problems and significant risk of vision loss if their dry eyes and treated appropriately. So there's a range, a spectrum of how bad someone's dry eyes can be. And we've learned a lot more about dry eye too. Some people's eyes are dry because they don't make enough tears. Other people make enough tears, but the type of tears they make isn't what it should be. Tears are very complicated. We learn more about dry eyes all the time. So we've come a long way in terms of the diagnosis of dry eye and the treatment of dry eye. And generally speaking, if we can get someone in a dry eye treatment plan that's not too complicated, and they can wear contact lenses successfully, say by using artificial tears a couple times a day, or some of the medicated drops like Restasis or Xiidra, we feel pretty good about LASIK. So In the long term, LASIK won't cause dry eye, but early on, first month or two, especially in the winter months, if someone has LASIK in January, February, they will have a little bit of dryness, and then we might have to add some additional drops to the regimen. So at the end of the day, when we're evaluating someone for LASIK, we take a careful history. We do a lot more than just look at their eyes. We do specific dry eye testing, and then we put them on that spectrum. And again, if it's mild and it's well controlled, LASIK shouldn't be a problem. If they're way on the other side, we will not recommend LASIK.
Excellent. Let's see what how our poll is doing here. So we asked, do you primarily wear glasses, contact lenses, both, or neither? Looks like we have a lot of glasses wearers in the audience, and some contacts, some both, and we have some folks who do not wear anything for vision correction, glasses or contact lenses. So we have a lot of folks who come in who are just sick and tired of their glasses or contact lenses, and you know, if that's the case for you, we certainly could. We'd be happy to discuss LASIK with you. We have a lot of patients who come in and want to live more active lifestyles, or maybe they're getting married and don't want to wear glasses for their wedding day or their honeymoon or something. So a lot of great reasons to look into LASIK. So thanks, guys. We'll get back to our questions here. We have more rolling in. We have one viewer ask, my grandma has cataracts, but she was interested in LASIK. Would that be an option for her or no? So if we detect cataracts in the eyes, we do not consider LASIK.
That is correct.
Yes.
You bet. Yeah.
Okay.
So that then we shift over to what we call laser cataract surgery, which is not LASIK, but it's actually using lasers similar to what we use in LASIK to do the same thing. Remove a cataract. Everyone that has a cataract removed has to have an implant put in the eye to take the place of the lens. Clouded lens is called a cataract, so we got to replace that if we take it out. And many times we can reduce or eliminate a person's need for glasses with laser cataract surgery and not do LASIK. So LASIK alone would not be a good idea for grandma.
Okay, because that cataract will still be there.
Right.
What are some common side effects of having LASIK?
Well, we talked a little bit early on the first day, maybe the second day too, that there will be a little bit of foreign body sensation, like you've got a little something under your contact lens, a little bit of irritation, maybe some dryness. It does take a few days for the vision to come back. When you think about the progress that we've made over the last 100 years of vision correction, remember I was talking about the Japanese doing RK on their soldiers getting ready for battle. Well, the RK result, I mean, it worked, but it wasn't predictable, it wasn't precise. There were side effects, there were complications, and to see where we've gone over this 100 years is just remarkable. So if people expect to get off the chair and get back to all their full activities the next day, they'll be disappointed. Now, they can get back to their full activities within a week, but we want them to heal up. We want to make sure that things are going well. Mm-hmm. Occasionally, people have to go back and get a touch-up or enhancement. And it's not that the laser failed, it's just that we have a nomogram or a cookbook. So in other words, I've done over 40,000 LASIK procedures. And we take all that data, we put it in a computer, we look at it, and we do something called regression analysis. That's like taking the past data, putting it into our cookbook. So we're constantly updating our cookbook. So, you know, if you made pumpkin pie last year and your family didn't like it and it said it was too bitter, well, you change the recipe a little bit. Sure. And maybe put more sugar in there and less salt, right? So we kind of do the same thing. So number of pulses that someone, so the laser when you're getting treated involves the eye being reshaped with the excimer laser, and you can hear it make a light tapping noise. In general, the worse your eyes are, the thicker your glasses are, the more taps you're going to get. So we always are constantly looking at our nomograms and say, okay, you're mildly nearsighted, how many taps are you going to get, versus you're really bad, how many taps you're going to get. And we continually put this back in our formula, and so we're always striving to get everybody perfect. Now, if you look at the human population, distribute ourselves, whether it's height or weight or even our prescriptions. If you look at the general population, it's a bell curve. So in the middle, most of us have normal eyes. We're not nearsighted or farsighted. And then it kind of spreads out. There's quite a few people, there's more people nearsighted than farsighted, but extreme nearsighted people are pretty rare. And then as you get less nearsighted, there's more and more. And so what we're trying to do with our regression analysis is get it so that our enhancement rate, our touch-up rate is 0. That's our dream. We're down to about 3% now, which is absolutely remarkable, much better than the national average of 8%. And so if someone comes to me and says, you know, I will only be happy if I have perfect vision after LASIK on day 1 with no risk of complications, well, then we won't even do it. Because I've seen people, unfortunately, wear glasses and they were hit by a softball or a baseball and the glass is shattered and cut their eye. And I've seen terrible eye infections from contact lenses. So nothing that we do is totally risk-free. And when we compare, when I compare anyway, in the last 10 years, severe complications from contact lenses versus complications from LASIK, the all-laser LASIK, I've seen worse problems with contact lenses than I have with LASIK.
Wow. Good.
Long-winded answer. Sorry about that.
No, that was great. And we would, of course, you know, walk each patient through the process, and we will certainly let you know all the list of restrictions and things to keep in mind afterward as well. So
yes, we
keep all patients in the know. We have one question from someone who actually had LASIK done in 2008. I have noticed starbursting at night to where it affects my driving. Is there a way to fix that?
Well, what we need to do is have them come in for an exam and find out what their current state is. Are they, for instance, one of the things we look at, say, are they developing night myopia? So night myopia is a situation where at night, someone's pupil gets bigger, and then it actually makes them become nearsighted. And if anyone who wears glasses or contacts goes out at night and looks at the moon or looks at a headlight, they'll notice halos and starbursts just because their nearsightedness isn't corrected. And especially that can be compounded at night if their pupil gets bigger. So we look for signs of night myopia. We look for if this person had, let's pretend they were 50 years old and had LASIK done in 2008. Well, now they're close to 62, and they may have the start of some cataracts. LASIK does not cause cataracts, but it doesn't stop cataract formation either. And so we have to look and make sure that cataracts haven't formed. We also have to look at who did their LASIK and what laser was used. There's several lasers on the market, just like there's Ford and Chevy and Buick. There's Vizix, and Elcon, and Bosch and Lomb, and different lasers in different generations of those lasers. So in other words, even the Ford Mustang, I'd like to think that we have the BMW, I guess. So the BMW X5, for instance, that's built today is a lot more sophisticated than the BMW X5 that was built 10 years ago. And so if someone had laser in 2008 and had a less sophisticated laser that's available today, sometimes we'll go back and there's a whole list. There's actually 60 things we look at. So if you came in and said, I want LASIK, I'm going to check 60 things out. And I've had lawyers tell me that, you don't have to do all that stuff. So it's not the standard of care, but we do it anyway because our success rate is good because we're that careful. So it might be that they had laser done 12 years ago on a laser that didn't have a custom ablation. And it was more of a standard treatment where sometimes we could go back and do a custom enhancement and help them there. So the first step on something like that is to come on in.
Sure, get evaluated. Excellent. We have a question coming in. How long does the procedure take? And can I go back to work the next day? Great question.
Yeah. So the procedure usually takes about 15 minutes for both eyes to be done. We do both eyes at the same time. Now, back when we started LASIK, I hate to say this, but when we started LASIK at the turn of the century, that sounds terrible, but that's been how long it's been going on for. When we first started LASIK, we do one eye and then the second eye a week later, but quickly we found that the results were so predictable and it was safe that we could do both at the same time. Mm-hmm. So the treatment time in the laser room is about 15, 20 minutes. Now, the total time at the center will be a couple hours because we'll have someone come in, we'll check them in, just make sure everything's okay, give them a little Valium to get them relaxed, then they chill right here where we're sitting now. They can watch TV or watch the fire and they're chilling. And then we go over post-op instructions too. So about an hour and a half or so that they're here, but the actual treatment time is only about 15 minutes.
Wonderful. And kind of going back to work the next day, I think it may depend on what the occupation is as well.
Good question. I mean, excellent comment. So our busiest days are most of the time we do the LASIK either on Thursday afternoons or Friday afternoons. Mm-hmm. So our most favorite day is Thursday afternoon, to be honest with you. So patients will work Thursday morning, they'll come in, get their LASIK Thursday afternoon. We'll see them Friday morning to make sure everything's okay. They'll usually take Friday off and then back to work Monday. Foundry workers, for instance, or someone, road construction where it's really dusty, dirty, and they can't get light duty or clean duty work, they'll take a week off. But that's the exception. And like I said, most people, if they had it done on a Thursday or Friday, could be back to work on Monday.
Excellent. We have a question coming in about eye drops as well. Do you need to use eye drops for LASIK?
We do use eye drops for LASIK. In fact, we use eye drops for cataract surgery too. We think that drops are the best way to get the best result. So after LASIK, we use an antibiotic drop to ward off any infection. And we use an anti-inflammatory drop, typically a steroid drop, to keep the eye quiet to prevent any haze or scarring. Those drops are typically used for a week, and then they're stopped.
Excellent. I think we have time for just a couple more questions. We have one question coming in. How do you keep the patient's eye still and open during the procedure?
Good question. So we have a device called the Speculum. We're kidding around, we'll call it the jaws of sight. Sometimes people don't like to keep their eyelids open as much as we would like, and we have to put a little extra pressure on it, but we have a speculum that keeps the eyes open, and so patients don't have to worry about that.
Okay, sounds good. And another one, are you sedated during the procedure?
I'm not sedated, but the patient is. And most of our patients find that 5 or 10 milligrams of Valium is enough to just cut the edge. It's like shooting a free throw. In other words, we wouldn't want you so sedated that you couldn't make the free throw. And of course, this is a big deal. People are, they're having their eyes worked on and they only have 2 eyes, and vision, of course, is extremely important. So they're a little bit nervous when they come in, and like I said, that 5 or 10 milligrams of Valium really helps get them relaxed. So by the time they get to the laser suite, they're good to go and they're nice and relaxed. So occasionally we'll give a little bit more than that, but most patients do really well with that.
Wonderful. And we'll take one more question here from a patient. I've been lasered twice on my left eye glaucoma outlet. Most recently a week ago. If there's no improvement, what's next?
Well,
glaucoma.
That's a tough one. In general, for glaucoma, we talk about eye drops, laser, surgery. And that's probably the way you should think about it. So it's amazing how many eye drops there are for glaucoma now. You can, in theory, think of probably over 60,000 combination of eye drops that someone could take for glaucoma, because there's, I think, 7 families of eye drops. And then within each family or category of eye drops, there's probably 4 or 5 choices. So you figure, okay, I'll take choice number 1 on this finger, choice number 3 on that finger, et cetera, et cetera. I mean, so drops, we assume drops have failed. If the laser doesn't work, then you're looking at traditional surgery, and that's changed quite a bit too.
Okay, sounds good. And yes, the one other question we got in, I think it's a good one off. We're talking about payment plans. We absolutely do offer payment plans. We work with a company called Care Credit. They actually offer our patients 24 months of 0% interest financing. So yes, that's definitely an option. So bonus question there. I thought that was a good one. But we're going to go ahead and wrap it up here. Thank you guys so much for tuning in. Wonderful questions. Dr. Vrabec, thank you so much again for all the great information and for being here.
Well, thank you, Tricia. It was really nice to have this chat.
Yes, this was great. So our first webinar, I would call it a success. So
well, thank you.
Yes, thank you guys so much again. If you do have any additional questions or you want to go ahead and schedule your free VIP LASIK consultation, please give us a call. We'd love to talk with you. The number again is 800-1-800-344-4443, or you can visit our LASIK Education Center on our website, valleyeye.com. Again, for viewing, we will offer everyone a $200 discount toward their LASIK procedure. So come on in, have a free consult done. We'll see if you're a great candidate, and we'll assist you from there. So thank you everyone very much. Have a great night.